I understand and consent that the following information will be gathered and utilized for educational purposes by Indiana Wesleyan students. I allow this information gathering and physical assessment to be videotaped and posted on Blackboard for access by faculty and students at Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty and staff, and as well as the student are not considerable liable.
Hello, Liz.
Hi.
I'm Leslie. I'm going to be your nurse today. What brings you in to the office today?
Well, I'm just feeling really stressed out. I can't think straight. I take these things, they're not working, I take them, it doesn't go away. When I start feeling like this, my chest hurts and, I'm just so stressed out. This nursing school thing is killing me. I have a test every week. I just don't find the time to study. This girl in my class, she asks questions all day long. I mean, we only have 3 hours in class. Like, can she please just get it together? The teacher answers her question and then she has another question. Well, why did they do that? Well, why did they do this? I mean, I'm just so stressed out and this medicine just doesn't work.
How long have you been taking this?
Well, it was prescribed to me about a month ago, but I mean, I take it when my chest hurts, when I start feeling anxious.
Okay, so you're only taking it when you're anxious?
Yeah.
Okay.
Isn't that what it's for? Is that what anxiety medicine's for?
Well, this medicine you need to take every day, whether you're feeling anxious or not.
Every day?
Yes.
Well, they didn't tell me that.
Who prescribed this to you?
Dr. Smith.
Is that your primary care doctor?
Yes, Michael Smith.
Which pharmacy do you use?
Walgreens in Stony Brook.
Are you being treated by any other physicians?
I did see a psychiatrist once.
How long ago was that?
Probably like 2 years ago. I was having some depression problems. My mom got really sick and I just got really sad. He went away though.
Do you remember his name?
It was like John Daughters.
Alright. Have you noticed your heart beating fast when your chest hurts?
I feel like it's about to come out of my chest.
How often does that happen to you?
I would say probably 4 times a week, especially when I'm lying in bed at night. That's when I just can't sleep. I just sit there and I think and then I have to go to the bathroom and I'm hungry and I just can't focus. I can't sit straight.
Do you have shortness of breath whenever that happens?
Sometimes, yes. My chest will hurt. Almost feels like somebody's sitting on me. Like I can't breathe.
How do you feel right now?
Kind of short of breath. I just feel real shaky and just real aggravated, irritable.
If you had to rate your anxiety level on 1 to 10, what would you say it is at this moment?
Like a 7.
Have you been eating okay?
Yeah.
You feel like you have a good appetite then?
Yeah.
Any special diet that you're on?
Oh no, I eat whatever's in sight.
You're not taking any supplements for weight loss, energy drinks, or anything like that?
No, I take a multivitamin every day, the vitamin gummies.
Okay. Any other medication?
Nope, just my multivitamin.
Are you having any pain right now?
Oh, and I take a daily allergy pill, sorry. No pain.
Okay, I'm just going to check your pulse. Your heart rate's up a little, 110. That shows me you're probably a little bit anxious. Next, we'll take your temperature and your blood pressure and your oxygen level. And everything is normal there. Do you have any living wills or medical powers of attorney?
No.
Can I get an emergency contact for you?
Sure, my boyfriend, Dwayne Cutts,
And a phone number for him.
555-2211.
Okay. And then I'm just going to do a quick assessment on you. And you know where you are right now?
Yes, I'm at Norton Community Associates.
Okay, I'm just going to look at your pupils. Just look straight ahead. Do you know what year it is?
2013.
Grab my hands, please. Okay. Just going to listen to your heart and lungs. Deep breaths. Two more. Sounds good. Lean back just a little bit and we'll listen to your belly. Are you having normal bowel movements?
Yes, I feel a little bit constipated lately.
It could be the medicine that you're on. You need to get some teaching in order for the Prozac that you're taking, and then maybe you'll get some more benefit from it. I'm going to check your pulses here. Do you have any wounds or bruises or anything right now?
No, ma'am.
Skin looks good.
I am a smoker.
How long have you been a smoker?
I smoke a pack a day, and I've smoked for about 6 years.
Do you have any plans to quit?
No. Not until nursing school's over.
One pack per day for 6 years?
Yes.
Any medical history?
I had sinus surgery in December of 2011. That's pretty much about it.
Any problems as a child?
Cat scratch disease when I was 6 years old. I had surgery in 1996.
Do you have any cultural or spiritual considerations?
Nope, just Christian.
Now with this anxiety, do you have any thoughts of harming yourself?
No.
Does your family have any history of mental health problems, or are you other than the depression?
Yes, both my parents have dealt with depression, and both of them have taken Cymbalta and Wellbutrin.
Any developmental problems such as like ADHD, autism, or anything physical that was like a congenital defect?
No, not that I'm aware of.
Have you lost any weight recently?
Actually, yes, I think I've lost about 5 pounds.
But you said your eating habits have not changed.
No.
How long have you lost 5 pounds?
Probably about 3-week period. Really hot in here.
Do you feel more anxious coming to the doctor?
No, I feel better coming to the doctor because I'm hoping that we can fix what's going on and make me feel better.
Do you feel like talking to someone about your anxiety would help?
I mean,
Like a counselor?
kind of, but, you know, I just don't think they'd really understand, you know. I just feel like, I mean, I don't want somebody to ask me, well, how does that make you feel every 5 minutes, you know what I mean?
Do you have a good support system at home?
Yeah, it's okay.
Any problems at home?
No.
What's your family life like?
Pretty normal, I'd say.
What do you mean by normal? Parents are supportive of being
yeah,
successful.
they're supportive. They don't do drugs. They don't have any drinking problems. They, you know, support me financially when needed. They, I mean, obviously me and my mom argue sometimes. You know, she can be kind of annoying, but
How long have you been in nursing school?
For about a year and a half.
So you did have a little bit of depression before you went into nursing school. And you felt like that went away before you started?
Yeah, definitely. I don't think I was really depressed, but whatever the doctor says.
What sent you to the psychiatrist then?
Dr. Smith recommended that I see one because I was having thoughts of harming myself.
But you never had an attempt?
No.
Do you feel like there's anything specific that triggers your anxiety?
Well, that girl in class definitely triggered my anxiety. I'm just sick of her asking all those daggone questions. And right before a test, I mean, I just get really anxious. I can't sleep the night before. I just freak out. I mean, like, I can't fail nursing school. What am I going to do? Be like a garbage truck driver? I mean, what?
Well, I think anxiety is pretty normal for someone that's in nursing school. We can together develop a plan of care that's going to help, to lessen your anxiety during tests and when you get you educated on your medicine. Hopefully once you start taking it every day, we'll have you come back in a couple weeks to evaluate whether it's working. It may even take a month or longer, so we'll give you information on how to cope with things and how to take your medication properly. So hopefully with a culmination, we'll get everything in order for you.
So how long do I have to take this exactly?
We'll see. Maybe 6 months, maybe a year, maybe a couple years. We can try and get you off of it maybe once your anxiety starts getting better.
And I need to take it every day, even if I feel anxious or not?
Yes.
Okay.
Every night.
Every night?
Until you sleep.
Okay.
All right.